Name's Josh. I'm a nurse practitioner student at Radford University. I'm going to be doing a head, eye, ear, nose, and throat, as well as a skin and nail exam on you today. May I have your permission to do so?
Yes.
All right, perfect. What I'm going to do before we get started is I'm going to wash my hands. As I'm doing that, can you tell me your name?
Sarah.
And can you tell me today's date?
September 16th.
Can you tell me where you're at?
7:13 Ambler.
All right. Patient is alert and oriented times 3. Are you having any pain right now?
No pain.
All right, no pain noted, 0 out of 10 on the pain scale. So what we're going to do is we're going to start with the skin. I'm going to assess that with the dorsal part of my hand. And what we're looking for is color, temperature, any lesions, texture. We're going to note skin turgor, so no tinning noted. Skin appears warm and dry. We're going to take a look at the nails. So what we're looking at in the nails, pigmentation, any rigidness, texture, firmness, and we're also going to check capillary refill, which is less than 2 seconds. Perfect. All right, so what we're going to do now is we're going to move on to the head and the skull. So I'm going to check for symmetry, shape, any lesions, any signs of trauma. We're going to take a look at the hair for color distribution and texture. We're going to also come down and take a look at the face for symmetry, any unusual irregularities. Also, I'm going to palpate the frontal and maxillary sinuses as well as the mastoid process. What we're doing is checking for patency and any tenderness.
No pain.
No pain? Oh,
No.
no pain. All right, perfect. So what we're going to do is we're going to move on down to the neck area. I'm going to take a look at that, and we're looking for symmetry. We're going to take a look at the range of motion if you can move your neck side to side. All right, perfect. I'm also going to inspect and auscultate the carotid pulse. We're going to use the bell and the diaphragm of the stethoscope. All right, perfect. So also, while we're on the neck, we're going to take a look at the trachea. We're going to do a couple things with the trachea. We're going to assess the trachea, and we're also going to do the thyroid. So if you would, what I'm going to do to check the thyroid isthmus, fingers 3 centimeters below thyroid cartilage. Take a drink of water for me. Hold it. Swallow. All right, thyroid isthmus should move while the patient is swallowing. Also, trachea appears midline. And what we're going to do now is we're going to check the thyroid. So I'm going to take my left thumb, place it on the side of the trachea. We're going to push the trachea over a little bit with the left thumb. I'm going to take the first 3 fingers, place it on the other side of the trachea. Have the patient take a drink of water and swallow for me. Perfect. And then to do the other lobe, this is assessing the left and right lobe of the thyroid. So then I'll use my right thumb, first 3 fingers on the left hand, and we're going to do the same thing and have the patient swallow again. You don't need to do that right now.
Okay.
So what we're checking for is that we're checking the thyroid gland. We're checking the right lobe is slightly larger than the left. We're checking for nodules, palpable. Thyroid gland should be firm and non-tender. So as we're still on the neck area, we're going to check the lymph nodes. We got the occipital lymph nodes at the base of the skull, post-auricular lymph nodes at the mastoid process, preauricular nodes in front of the ear, parotid nodes at the angle of the mandible, submandibular nodes at the tip of the mandible, submental nodes, which is behind the tip of the mandible. Also, we're going to do the anterior cervical nodes at the sternoclavicle mastoid muscle, posterior clavicular nodes at the anterior trapezius, and posterior cervical nodes deep. And we're going to do the supraclavicular nodes at the angle of the clavicle. So one note that we want to do is we're going to use the pads of our fingers when we do this. We're going to start with light palpation, and we're going to increase in pressure as we do this assessment on the lymph nodes. So now we're going to move on over to the eyes. I'm going to grab my ophthalmoscope here. So what I'm going to do is I'm going to check the eyebrows. We're going to palpate the orbital area. We're going to check the conjunctiva and sclera, which appears white and intact. All right, if you would, just look straight ahead for me. All right, we're checking for perla. The eyes, pupils are equal, round, and responsive to light. Accommodation is noted. Also, if you would, someone just stare straight ahead for me, and I just want you to follow my pen. So we're going to check the cardinal movements of the eye, which are 6 movements here. Perfect. All right, so now that I still have my ophthalmoscope, we're going to try to view, we're going to take a look at the back of the eye. We're going to look at the fundus, the red reflex, and hopefully we're going to take a look at the optic nerve. So what we're going to do is when we do this, if I'm checking the patient's right eye, I want to use my right eye. Ophthalmoscope needs to be placed in my right hand. Cogwheel set to 0. As I approach, I'm going to get that red reflex. I'm going to use my free hand to stabilize myself on the patient's shoulder, and I'm going to use the cogwheel to focus as I'm coming in and taking a look at that. And I actually think I see that optic nerve, which appears orangish pink, it looks like. All right, perfect. So that was the right eye. To do the left eye, I'm just going to switch. I'm going to use my left eye to assess the patient's left eye. Ophthalmoscope is going in my left hand, and we're going to do the same thing. So I'm going to sit this down. We're going to move on to the ears. I'm going to grab my otoscope. I got a clean speculum here. So what we're going to do is I'm going to take a look at the ears for symmetry. Any pain or tenderness noted in the ear?
No.
All right. So I'm going to inspect the ear canal, and what we're going to look for is any foreign objects and any earwax, the cone of light, and we're going to take a look at the tympanic membrane, which appears intact. So on an adult, we're going to pull the pinna up and back. On a child, we want to pull down on the ear to take a look at that. So we're going to do the other side, same thing, checking for earwax, any foreign objects, and we're taking a look at that tympanic membrane, which does appear intact on this one as well. Perfect. All right. So one other thing we're going to do with the ears is I'm going to do a whisper test. So I'm going to say 3 words, and if you would, just repeat those back to me. Dog, parrot, whale.
Dog, parrot, whale.
All right, perfect. I'll take your drink if you'd like. We'll set it over here for you. Okay. So we're going to move on to the mouth now. I'm going to grab a pair of gloves here. We're going to check your lips, buccal mucosa. We're going to take a look at your teeth and your gums. Any pain in your teeth at all?
No pain.
Any missing teeth?
No.
All right. Let's take a look at your lips here. Perfect. And stick out your tongue for me. All right. And just relax. I'm going to take a look at your... All right. Gums appear pink and healthy. No signs of missing teeth. Any loose teeth at all?
Nope.
All right. So what I'm going to do now is I want you to take your tongue, stick it out for me, move it side to side, touch your nose, and come down to your chin. So what we're looking at is cranial nerve 12, which is the hypoglycal nerve. So the cranial nerve 12 appears intact. So now what I'm going to take a look at is I want you to say ah. Still okay. Tonsils are noted, appear symmetrical. Doesn't look like they protrude across the pillars. Uvula is noted midline. Last thing I want to do is I'm going to take this and I want to touch the posterior oral pharynx, and that's going to elicit a gag reflex to check that, okay? All right. All right, so that concludes our exam. Oh, we need to check the nose. So what I want to do with the nose real quick is I want to check for patency. We're looking for symmetry. And if you would, cover up one nostril for me. And go ahead and breathe out that. All right, and cover up the other nose, the other side. Perfect. So what I'm going to do is I'm going to change out my speculum here. We're going to get a new one. I'm going to use my otoscope, and we're going to take a look at the nares in the nose real quick. So with the patient's head being in the erect position, this will allow us to look at the nasal mucosa as well as the inferior turbinate. All right. So with the patient's head backwards, this will allow us to look at the middle turbinate, and then if I retract the speculum to midline, this will allow me to see the septum. Excuse me. So the turbinates appear pink. There's no signs of any drainage or anything like that, and the septum does appear midline. So, all right. That concludes our exam for today. Thank you very much.